everyone, I'm Anastasia signing in from NORAS. In this session, we will be dealing with a topic known as bowel wash. Bowel wash, also known as enteroclysis, is defined as the washing out of the colon after the fecus has been expelled by using a large quantity of solution. The purpose of performing this procedure is to prepare the patient for certain diagnostic examination as well as before performing certain surgeries. It is also done to relieve inflammation, to stimulate the peristalsis, to dilute and remove any toxic agents, to help in reducing the body temperature, especially for those patients who are suffering from hyperpyrexia, to relieve fecal incontinence, to supply medications locally, to clean the colon, as well as to treat infections and other pathological conditions of the colon. So these are the purpose for which bowel wash can be performed. Now, this procedure is also contraindicated in certain patients if they are suffering from conditions such as chronic diarrhea, bleeding hemorrhoids, if he or she has just undergone any rectal surgery, or if he or she is having any infection in the rectum, in cases of intestinal obstruction, of renal polyps, of massive colon carcinoma, loose anal sphincter, debilitation if there is presence of anal fissure, intestinal diverticulum, as well as painful skin lesion around the anus. So here, if a person is suffering from certain infections, if he or she is having any inflammation in the perineal area, or if they are suffering from the above disease condition, then this procedure will be contraindicated for them. Now let us discuss about the general instructions. Here, as a nurse, before you provide this procedure to the patient, you must make sure that a cleaning enema must be given 1 hour prior to the colon irrigation. The bladder must be emptied. The temperature of the water must remain constant throughout the procedure. We must allow only 200 to 300 ml of fluid to run into the rectum at a time. We must make sure that the return flow must not be blocked. We must make sure that we use a smooth and a flexible tube, as well as we must make sure to lubricate the tube before it is inserted. We must prevent the entry of air into the intestine, which can happen from the tube. We must also stop the procedure temporarily if the patient complains of pain. And as a nurse, it is very important that we must listen to the complaints of the patient, which can be related to pain or discomfort. and we must never ignore their concerns or their complaints, no matter how small it may be. As a nurse, these are the instructions that we must follow. And for this procedure, there are three methods through which we can perform. The first one is the funnel and the catheter method. The second is the Y connection and the rectal tube. The third is the tubing method. So these are the three methods through which bowel wash can be performed. As we have also discussed in the definition, that bowel wash is defined as the washing out of the colon after the feces has been expelled by using a large quantity of the prescribed solution. So here, the solutions that can be used for this procedure include the tap water, the cold water, the normal saline, sodium bicarbonate, antiseptic solution, silver nitrate, boric solution, and even tannic acid. Depending on the prescribed solution, depending on the solution that the physician ordered, we will be using that. Here there are also different temperature depending on the purpose. If this bowel wash is being performed for a cleaning purpose, then the temperature of the solution can be 104 degree Fahrenheit or even 40 degree Celsius. If it is being provided for the thermal effect, then the temperature must be between 110 to 115 degree Fahrenheit or 43 to 46 degree Celsius. And if it has been provided in order to reduce the body temperature, then here the temperature of the solution must be between 80 to 90 degree Fahrenheit or 27 to 32 degree Celsius. So here, depending on the purpose, the temperature of the solution will vary. Before we perform the procedure, we must do the preliminary assessment, whereby we will be checking the doctor's order for any specific precaution. We will be assessing the diagnosis of the patient, the general condition of the patient, the self-care ability of the patient, their mental status, so that we will be able to get an idea whether they will be able to follow instructions or not. We must also assess if there is presence of any contraindications, if extra help is required, and even if all the articles which will be used in this procedure is available or not. Once the preliminary assessment has been done, we can then prepare the patient and the environment. Here, the first thing what we must do is we must explain the procedure to the patient. We must arrange all the articles which would be required in the patient's bedside. We must provide privacy in order to enhance their comfort level. We must place a Macintosh as well as a towel under the patient. we must position the patient in a left lateral position, and we must also keep a bucket on a low stool in order to receive the outflow of a fluid. Once we have performed the preliminary assessment, once we have prepared the patient and the environment, we can then start off with the procedure. However, as we have discussed that all the equipments must be collected and arranged in the patient's bedside. So what are the equipments that would be required? Here we will be needing a clean tray containing a funnel and tubing with glass connection. We will be needing a Macintosh and towel, rectal tube, kidney tray, Vaseline, rack pieces in a container, 3 jugs where one contains hot water, the other cold water, and the third one containing the prescribed solution, a paper bag, bucket, toilet tray if required, clean linen, as well as a bath thermometer. So these are the various articles which would be required, and once this has been collected, then we can start with the procedure. Here again, the first step that we must do is we must wash our hands thoroughly and don gloves. We must prepare the required solution at a required temperature. We must attach the tubing and the rectal tube with funnel, and then we can start pouring the solution in it in order to check if there is any leakage. Once the tubings has been attached, we must then lubricate the rectal tube for about 4 inches. We must fill the funnel with the solution and expel the air from the tubing by allowing a small amount of fluid into the kidney tray. And once this is done, we must pinch the tube or close it with a clamp. So here, after the tubings has been checked and connected, we must then place the patient in a left lateral position. We must bring them close to the edge of the bed. We must separate the buttocks in order to get a clear visualization of the anus, and then we can start inserting the rectal tube up to 4 inches. And while inserting, you must advise the patient to take deep breaths through their mouth. You must lower the funnel below the level of the rectum, as well as empty the return flow into the bucket. Once the return flow has been emptied, you will be raising the funnel above the rectum. You will be pouring the fluid, and before the fluid is emptied from the funnel, you will then pinch the tube and you will invert the funnel as well as lower the funnel below the rectum into the buckets where the return flow will be collected. So here this process will be continued and repeated until the return flow is clear. This is the reason why observation and noting the characteristic of the return flow is very important. Here, as a nurse, you must temporarily stop the procedure if the patient complains of pain or discomfort. And if the patient has no complaints, and if the required amount of fluid has been administered, then you can gently remove the rectal tube by pulling it through 3 to 4 layers of rag pieces or tissue paper. And once this is done, you must discard the rag pieces or the tissue papers in the dustbin. You must place the funnel and the tubings in the kidney tray. If the patient is able to walk, then you can assist the patient to the toilet, whereas if he or she is bedridden, then you can use a bedpan in order to clean their perineal area. You must change the bed linen if it is soiled. You must place the patient in a comfortable position. You must replace back all the articles after it has been disinfected and sterilized. You must remove your gloves and perform hand washing in order to prevent cross-contamination. And then you must document the procedure in the nurse's record sheet. Here, while documenting, you should make sure that you mention the patient's name, the date, the time, the procedure, as well as what were the complaints or what were the complications that the client has complained of. So these are the various steps that you need to follow when you are performing this procedure, when you are providing the bowel wash. So now we have come to the end of this topic, whereby in today's session we have discussed what is bowel wash, what is the purpose, what are the conditions in which this procedure is contraindicated, what are the general instructions, the preliminary assessment, the articles which would be required, as well as the steps that we need to follow in order to provide a bowel wash. So I hope you have got a clear understanding. I'll be meeting you in my next session. Until then, have a good day. Thank you.